Today, I want to talk a little bit about how regenerative medicine can help heal the body. As a functional medicine nurse practitioner, my goal is to help the body to do its job, and the body really should heal itself. And regenerative medicine is a perfect fit in my practice because it really accomplishes that goal of helping the body to heal itself. I'm Joya Vanderlaan. I'm a family nurse practitioner. I do functional and integrative medicine here in Illinois, and I'm licensed in a handful or two of other states as well. So first, I sort of want to just define, what do we mean when we say regenerative medicine? It seems like that's a pretty big buzzword lately, and maybe you know what it means and maybe you don't. So regenerative, we want to focus on therapies that regenerate tissues, regenerate damage in the body. And whether that damage is from an autoimmune condition or an injury or overuse, the tissue needs to repair, or that person is going to have symptoms of pain, of inability to function properly. In the case of a rotator cuff tear, that patient is going to have trouble lifting the arm beyond a certain point, especially without pain. So we're dealing with pain, we're dealing with limitation of function, and then at its core, it's a tissue dysfunction that is an unhealed tissue, a degenerated tissue. When we're looking at different options for regenerative therapy, there are quite a few. Most of us will think of stem cells or Wharton's jelly, maybe some exosomes. First, amniotic fluid is a really important example there. But we have to remember that things like peptides and ozone and even hormones and balancing nutritional status are very much regenerative. A lot of times all these work together, and one of my preferences when I see patients for regenerative medicine is to optimize as many of those as we possibly can so the patient gets the best possible outcome. So stem cell therapy, or Wharton's jelly, exosomes, purified amniotic fluid, that is part of regenerative medicine. Another option is PRP, or platelet-rich plasma. And this is actually harvested, is sort of an intense term, but harvested from the patient's own body and injected back in. We draw a little bit of blood, 1 tube, maybe 2, and spin it down so that the top, we get just that nice yellow golden PRP, platelet-rich plasma. And we can inject that as a very highly regenerative injection into a joint, into and around a tendon that has some tendonitis or inflammation or even tendinosis, and really promote healing and regenerate that tissue so that it becomes a normal, functioning, pain-free tissue, again, without surgery or steroids. Peptides are another really important piece of the regenerative puzzle for a lot of people. Sometimes peptides alone can cause enough healing, and sometimes we need to go to deeper and more sophisticated therapies like the stem cells or the PRP. With peptides, though, there are a variety of different peptides that we can use depending on the patient's situation. A lot of times patients come to me asking about BPC-157. That's sort of one of the most common peptides and sort of well-known peptides if you're into peptides. But there are lots of others that can be helpful as well, and sometimes we'll use those in conjunction with other regenerative therapies to potentiate results. How do these regenerative injections cause the body to repair itself? Well, they're signaling molecules. MSCs is a common way that we refer to a stem cell injection, for example. MSCs stand for medicinal signaling cells. So like the peptides and even like the PRP, these are things that we're injecting into a joint or into even veins sometimes around tissues that are damaged or disturbed or painful. The body then gets that signal from these molecules to produce more of its own stem cells. This is why we can call it stem cell therapy, even though we're not injecting stem cells that are actually themselves going to turn into your new tissue. So it signals your body to create more of its own stem cells, very powerfully signals those. Modulates inflammation in the body. So we want some inflammation, and we want the good kind of healing inflammation. But if we have bad inflammation or too much inflammation for too long, those tissues are not going to heal. In fact, they can be damaged further. And then also these injections, these regenerative injections, help to modulate and modify the immune response. So basically we're creating a really perfect environment so that healing can take place with that immune modulation and inflammation modulation, while we're signaling the body to bring all of its resources, stem cells and other healing factors to that area to cause tissue healing. So 3 main benefits of these regenerative treatments. One is repair of damaged tissue, whether that's a partially torn ligament or tendon, whether that's arthritis and the cartilage is wearing down, whether that's a tendinosis that you've had for a long time, or an acute tendonitis that you haven't had for such a long time, but you really don't want to do a cortisone injection. Those are all tissues that have degenerated and that need to be repaired. And the body can repair those with regenerative injections. The second one, somewhat related, is injury repair. I have stories and stories of athletes who tore their ACL, and full tears aren't quite as responsive. You do need surgical interventions sometimes. But even after surgery, to make sure that we're doing everything we can to promote the best healing, stem cells are great. Regenerative treatments are great. In terms of injury repair as well, works really well in high school athletes all the way up to people in their 70s and 80s. We just need to make sure that we've optimized as much as we can before the injections to make sure that the patient gets the best results, both in terms of improved function and movement and also reduction of pain. And then in terms of longevity, we can also improve longevity with some of these treatments. When we are helping the body's inflammation and immune systems to work better, all the cells in the body work better, and that leads to much better longevity. And so a healthier, longer life, which is really a lot of the goal of my practice, is let's let patients live their best life, healthy life, long life, and be functional and have fun for as long as possible. One recent patient who I injected is a former boxer, amateur boxer, but he did a lot of boxing, and his knees, and particularly the left knee, was very painful, and it was so painful that he was not able to participate in the boxing that he loved to do anymore. And he's retired now, and he loves to just still be active, which I want to promote, but he was having a lot of pain and was worried that it was getting worse, and he was told that he may need to have a knee replacement surgery. So we injected him a couple of weeks ago. He's doing really well. What we're doing for him is actually a series of 3 injections, PRP first, then stem cell, then PRP again, so a couple weeks apart. And that healing power, I've seen it before, is so great. And really, we can help reduce pain, heal tissue, and avoid the need for drugs and surgery. I mean, it's wonderful. I'll give you an example of a little bit of a simpler case. I injected BPC into a hamstring, or around a hamstring. A very strained hamstring. This patient had gone for physical therapy and really was not getting too much better. She'd even gone for dry needling and really wasn't helping it get better. So we decided to try BPC, 157 injections into that area. And within, I think it was a day, she was feeling so much better. She went to the physical therapist again and overdid it a little bit, kind of tweaked it a little bit again. And this is the importance of resting a little bit after, not doing too much strenuous activity after regenerative injections. We want to allow the body to heal. But we did another round of those, or another appointment of those BPC injections to that same area. And once again, the pain just went away. So these work really, really well in so many patients. So as somebody myself, and in my own practice with all my patients, I like to avoid surgery, avoid medications as much as possible, and really provide treatments that are generally going to be healing and addressing root causes. And when we're talking about joint pain or joint degeneration, tissue degeneration, really the root is getting that tissue to heal. And I'm so thankful now that we have this technology. It was not available when I first started practicing. I'm so thankful that we have this, because now I can offer this to patients as an alternative to surgery, an alternative to medications that really is truly healing to the body. Each patient is different. And so before I ever approach anybody with a needle or a treatment of any kind, I want to sit down and understand what's going on so that we can choose the best treatment option for that person. The best way to start with that is setting up a 15-minute discovery call with us. It's free, and you can tell me a little bit about what's going on with you and what you were looking for help with. And then we can determine, is this the best place for you? Can we help you? The answer is usually yes. And then we can go from there if you're interested in pursuing these regenerative treatments. So book your discovery call with the link below.